everyone. Welcome to your Cultural Diversity Lecture. The following are the learning objectives. 1. Explain concepts of cultural diversity, including your key terms. Describe influences that affect culturally competent healthcare. Discuss examples of how diversity affects health and illness care, including culturally based traditional care. Identify factors commonly included in a transcultural assessment of health-related beliefs and practices. Practice cultural competence when assessing and providing nursing care for patients from diverse cultural groups. Discuss factors in the healthcare system and in nursing that facilitate or impede culturally competent nursing care. Okay, so let's talk about cultural diversity. So cultural diversity can be described as the coexistence of different ethnic, biological, sex, racial, and socioeconomic groups within one unit. Culture is an integral component of both health and illness because of the cultural values and beliefs that we learn in our families and communities. Culture typically guides behaviors into acceptable ways for people in a specific group. Culture is learned by each new generation through both formal and informal experiences. Culture can influence the way that individuals view themselves, and there may be differences even within and among cultures. Cultures typically share systems of beliefs, values, and behavioral expectations. They provide social structure for daily living, define roles and interactions with others and families and in communities, are apparent in the attitudes and institutions unique to culture. So like we said, cultures guide behaviors. They're learned. They can have a huge influence. They can have a huge influence on how somebody gets health care, what they do to treat their illnesses, and practices that many variety of cultures and that are diverse believe certain aspects will help them heal. We have to understand that cultural diversity includes many different cultures. It can be racial and ethnic origin. It can determine religion, physical size, age, and even gender, sexual orientation, disabilities, socioeconomic and occupational status, and even geographical location can have cultural diversity. So let's do a quick knowledge check. Culture includes the beliefs, habits, likes and dislikes, and customs and rituals learned from one's family. Is that a true or false statement? So think about it for a second. All right, so you had a second to think about it. Really, the correct answer is true. We know that culture is defined as a shared system of beliefs, values, and behavioral expectations that provide a societal or social structure for daily living. It can include beliefs, habits, likes, dislikes, customs, and rituals learned from families. So we also must understand that within a cultural or diverse group or population, there are such things as subcultures. So a large group of people who are members of a larger cultural group, and then members that have certain ethnic, occupational, or even physical characteristics not come into the larger culture. An example, a subculture can be even like culture in a nursing unit in a hospital. It doesn't necessarily have to do with race, gender, ethnicity, or anything like that. Think about the entire population of nurses in the US and how there are subcultures of that entire population. So as we move on, we're going to talk about dominant groups versus minority groups. And this is important in knowing cultural diversity because we need to know what the dominant group is. It's usually the largest. The group has the most authority to control values and sanctions of society, as opposed to the minority group, the smaller group. Typically a physical or cultural characteristic identifies the people as different from the dominant groups. Within the dominant group and the minority group, think about the US population and how the dominant or largest group in the US is typically Caucasians, whereas the minority groups include Hispanic, Latinos, Black, African American, Asians, Pacific Islanders. So they all coexist together, but we know that there is a larger group that typically will have more control per se, but they do coexist together. Okay, let's do a knowledge check. So, which of the following occurs when members of a minority group living with a dominant group begins to blend in and lose the characteristics that made them distinct? So take a second to figure out the answer. All right, so if you picked C, cultural assimilation, that is correct. So cultural assimilation occurs when one's values are replaced by the values of the dominant culture. Cultural imposition is the belief that everyone should conform to the majority belief system. Cultural conflict occurs when people become aware of cultural differences, feel threatened, and act negatively. Cultural shock refers to the feelings a person experiences when placed in a different culture. And I have a really good example of cultural shock. So I was born in El Salvador, but really I came to the US when I was about 5 or 6 years old, grew up here, went through all my schooling and everything. And one time, when I graduated high school, I was finally able to travel back to El Salvador and meet a bunch of family. And I can tell you, it was a complete culture shock to me. Although I am Salvadoran, I didn't grow up there, so it was completely a shock to me how different everything was. All right, let's talk about ethnicity. So ethnicity is a sense of identification with a collective cultural group. Largely based on a group's common heritage, one can belong to an ethnic group through birth or adoption of characteristics of that group. Groups share unique cultural and social beliefs, behaviors, and patterns. They largely develop through day-to-day life with family and friends and within the community. So we know that certain ethnicities have certain practices that get passed down, and if somebody marries into their culture or ethnicity, they then develop those behaviors. They're learned, they're shared. It is how we live our day-to-day life, with our families and friends within the community. So ethnicity has a collective cultural group. So kind of in a nutshell, or really, ethnicity essentially is self-identification with a cultural group, if that makes sense. Now, the other side is race. So race is typically based on specific characteristics, typically skin pigmentation, body stature, facial features, hair, texture. We have 5 major categories. So American Indian, Alaska Native, Asian, Black or African American, Native Hawaiian or Pacific Islanders, and white. And notice that Hispanic Latino is not considered a race because it is considered an ethnicity, and people who are considered Hispanic or Latino can actually belong in any of those racial groups, depending on what they believe or how they believe. So technically, let's say for me, I'm Hispanic Latino and my race is actually Caucasian. Although when I fill out all my forms and everything, I typically just fill out Hispanic Latino because I truly don't know what my race is, because there is a huge mixture of races in my family. So I don't really, unless I do one of those DNA tests, I don't actually know what my race is. As we continue learning about culture, we have to also learn about stereotyping. Stereotyping is the assumption that all members of a culture or ethnic group act alike. Some stereotypes may be positive, some are negative. The most important negatives include racism, ageism, sexism, bigotry, homophobia, those things that can be included in stereotyping. Some positive ones that may not seem like positive ones or can be a little off-colored, I guess I could say, would be women have a natural mothering instinct. Another one would be gay men are fashionable. Certain races are made for being athletes. So just kind of those stereotypings, they are positive, but may have a negative connotation to them. So let's do another knowledge check. This is a true or false. So stereotyping occurs when people ignore differences in the cultures in which they live and proceed as if they do not exist. Is that true or false? Take a second to think about that. If you answered false, then you are correct. It's actually describing cultural blindness, and cultural blindness occurs when people ignore differences in the cultures in which they live and proceed as if they do not exist. That's kind of like when people say they are colorblind and they don't see color in the people they interact with. It's very similar to that. So as we continue, we want to be able to identify prejudice. So the first step is identifying them so that we can eliminate them. And how do we go about that? So we're just going to learn some key terminology that is going to help us with eliminating prejudice. So these are important key terms, so they're important for you to know. Cultural imposition, so believes that everyone should conform to the majority belief system. Cultural blindness, ignores differences and proceeds as they do not exist. Cultural conflict, people become aware of differences and feel threatened. Response, ridiculing beliefs and traditions of others to make themselves feel more secure. Ethnocentrism. So this is the belief that one's ideas, beliefs, and practices are the best or superior or are most preferred to those of others. So a good example of cultural imposition would be a African American mother who is using a sling for her baby, but the nurse is adamant that bassinets are the safest for infants. So the nurse is basically imposing what she believes is correct on her own beliefs and experience, and not taking into consideration what this woman's beliefs are about carrying her babies in a sling. An example of cultural blindness is something like the debate over abortion. It's a huge debate. There is a lot of conflict, and it's a very cultural thing. We know certain cultures don't believe in abortion, while others are not. It's not that they don't believe, it's that they don't either practice it or they actually believe in the choice of abortion. An example of ethnocentrism is something actually very common that is with food, actually, where some cultures are totally fine using their hands to eat, others only use certain hands to eat, whereas some cultures use utensils and never want to get their hands dirty and need to always use something for their food. So that's it's ethnocentrism when we make it that our way of eating. So if my way of eating is not using utensils, and I believe that it is the best way to do it, and there's no other way, and I will never use utensils, and that is ethnocentrism. So here's another knowledge check. Which term describes what occurs when a nurse believes that one's own ideas, beliefs, and practices are the best or superior to those of colleagues and patients? Take a moment to answer it. All right. Did you take a guess? Did you guess D, ethnocentrism? And ethnocentrism is the belief that one's ideas, beliefs, and practices are superior or preferred to those of others. Cultural diversity refers to the existence of diverse groups in society with varying cultural characteristics. Culture shock describes the feeling of a person experiencing that they experience when placed in a different culture. Stereotyping is the practice of assuming that all members of a culture group act alike. So what are some cultural influences on healthcare? And so we're just going to go through this list and give you some examples of what they are. So physiological variations, that can be, certain racial groups or ethnic groups that are prone to certain diseases or conditions. For example, African Americans are at high risk for or carry certain hemophiliac genes, and so they are at risk or can be born with that illness. Another one could be Hispanics that are at high risk for diabetes or heart disease. Knowing these things will help identify how for earlier testing and maybe even prevention. So reactions to pain are typically influenced by culture. So think about a Hispanic or Native American gentleman who has a stoic face, isn't really showing signs of pain, but they have something that should be showing signs of pain, such as they're having a heart attack, they have a broken limb, they fell off a ladder doing some work, but they're sitting in looking stoic, and until we ask them what their pain level is, we don't actually get a true reaction. So this is why it's important that we always ask pain levels and we take what the patient says, even though they may not look like they're in pain. It could be a very cultural thing that they don't show how much they are in pain. In addition, about cultural influences reactions to pain is that you need to recognize that culture is an important component of individuality, and we have to respect the patient's rights to respond to pain in his or her own manner. And we don't typically stereotype a patient's perception of pain or their response to pain based on their culture. Mental health has a huge cultural influence. We know that the mental health can be a taboo issue for certain cultures, ethnicities, races. So it's important to make them more normal. And also that cultural groups will have their own norms and acceptable patterns of behavior for psychological well-being, as well as different normal psychological reactions to certain situations. An example in the book is how Hispanic people deal with problems within the family and consider it inappropriate to tell problems to strangers. So we can see how that could influence healthcare, because somebody with a mental health illness would not, that is Hispanic, would find it hard to seek help, like with a counselor, a psychologist, or whatever, because it is in the Hispanic Latino culture not to talk about our problems to strangers. So that is just one example of how mental health has cultural influences on healthcare. So gender roles, we know, play a huge component in healthcare. We know that some cultural background or groups or ethnicities have matriarchal influences. So that means they are led by a strong woman, or patriarchal, which is the man is the dominant figure in the culture. So it just depends if it's whether it's female dominant or male dominant. Most cultures will go either way, and they would rely on that dominant figure to help make certain decisions in healthcare. Language and communication is also will also influence healthcare in a cultural aspects, because we know that if the patient can communicate with their healthcare team, how will they be able to get better? Whereas we know when a healthcare provider speaks the same language as their patient, the outcomes are immensely better. So we know that language and communication in general can have a great impact on someone's healthcare. So orientation to space and time is in regards to really the physical distance you are with a person. We know some cultures don't like that up and close personal aspects of health. Knowing that, we need to be able to provide care, but in a respectful manner. Additionally, we know, I mean, even now with this, with COVID and the pandemic, more people are now so used to being 6 feet apart that they still want that space in between them. So it can be hard to change. And that's just how even what we call our personal bubble, or somebody invading our bubble, how it can affect our healthcare and how we take care of patients. The other aspect of that is time, right? So time is valuable. We tend to want to make sure we're on time, we're not late. We want to make sure we're respecting each other's times. Some cultures actually find it very, very disrespectful to be late. to not be where you're supposed to be at the time you're supposed to be. And then, kind of like on the side joke, we know the stereotype of Latino time or Hispanic time is some people actually make their parties, they say the time earlier. So the party starts at 4 p.m., but actually it technically starts at 5 p.m., knowing that in the Latino Hispanic community, they have what's called Latino time, and they actually show up like an hour later. That's definitely a stereotype because I know that when I get invited to birthday parties, I'm typically like really early, but on time per what the invitation says. So I thought that's just kind of funny. But it is important because some ethnicities and cultures find it extremely rude and bad if time commitments are not met. So food and nutrition, we know that certain cultures eat certain foods or they stay away from certain foods. Think of the Jewish community where they only eat kosher foods. They typically don't mix dairy products with any animal products. So like a ham and cheese sandwich would not be appropriate. One, because ham is pork and the Jewish community doesn't eat pork. Second is that you are adding dairy with a meat product. Other things are like halal foods. In Asian culture, they have a lot of hot and cold influences. So eating hot foods when they're very sick and cold foods for other things. So it's just those cultural considerations, because if we're taking care of somebody that is Jewish or Asian and they're not eating the food that's provided to them, we have to figure something out, because we do know that nutrition is has a huge role in healing when someone is sick. And if they're not intaking enough nutrition, they're not going to get better. So we have to figure things out, making sure that if the person is Jewish, that we're providing appropriate foods or allowing for family to bring foods in for the patient. Family support is also a big influence. So we know, depending on your ethnicity, background, culture, you might have one person at the bedside with you when you're sick, or you might have an entire family at the bedside with you, depending on your culture. And so knowing those things and knowing that maybe somebody that has a big family to come visit, maybe the patient needs to rest. We need to advocate for the patient, but also make sure that we're meeting their cultural needs as well. Lastly is socioeconomic factors. So we know that poverty is huge in the U.S., and we know how that affects healthcare. People who live in poverty don't typically seek healthcare until it's too late. They're sick, they need to go to the hospital, and then it's hard for them to recover or heal because they're so stressed out about the cost of going to the hospital and how they're going to support their family. And it's just those little things that we might consider little, but they're huge actually, for someone that doesn't have health insurance, somebody that's living paycheck to paycheck. And that is how socioeconomic factors into cultural influences on healthcare, because we know that certain cultures, ethnicities have a higher prevalence in poverty, thus leading them to not seek medical care or not keep up with their medical care because of lack of resources. And that has a great influence on healthcare in general. Just make sure that you understand each of these influences so that you as a nurse can assess and see how you are going to take care of your patient. So how does one become a culturally competent nurse, and how do we provide culturally competent nursing care? This slide is in regards to pain, but in general, as nurses, we need to provide culturally competent care. And the first thing that we need to do is, and I like to say it as know thyself. So we need to recognize that we have what's called implicit biases, and we make those stereotypes. As much as we say we don't stereotype people, we do it. It's what people, we are all human, we do it. But recognizing that you have some biases and then putting them aside when you are caring for your patients. So recognize that each person holds various beliefs about pain, and that pain is what the patient says it is. Respect the patient's rights to respond to pain in one's own fashion, and never stereotype a patient's responses to pain. And this is kind of a review on the list from the last slide. We have to be sensitive to nonverbal signals of discomfort. So that's seeing grimacing, but the patient is saying they're not in pain. Understanding that some patients don't outwardly want to say they're in pain. This slide goes over the culture of poverty, and this one goes back to that list of what influences culture has in healthcare. So poverty or socioeconomic status is one of them, and understanding the culture of poverty and how it kind of continues on generation per generation. So feelings, people who are in this culture of poverty typically have feelings of despair, resignation, and fatalism. They typically have a day-to-day attitude towards life with no hope for the future. And that's a huge thing that makes that cycle continue in poverty. Unemployment and the need for financial or government aid, unstable family structure, possibly characterized by abusiveness and abandonment, decline in self-respect, and retreat from community involvement. So these bullets typically are what we see in families that just continuously live in poverty, such as my like this is just an example. My mother's mother was a teen mom, and now this mother is a teen mom, and now that third generation is a teen mom. So it's a cycle of poverty. All right, we have a knowledge check here. Is it true or false? The healthcare system is a culture of its own, with nursing being its largest subculture. Is that true or false? Take a second. Okay. All right, if you guess true, that is correct. So the healthcare system can be seen as its own culture, and then nursing being a subculture of that healthcare system. So barriers that affect culturally diverse interactions: biases, prejudice, discrimination, racism, sexism, language barriers, and a huge one is lack of cultural awareness. And we know examples of biases and prejudice, discriminations. So I'm not going to go through each bullet point, but just know that these are the main barriers that affect those culturally diverse interactions. So those interactions we have with patients that are not the same culture as us. So elements of cultural competence, or I like to also call it culturally respectful nursing care, is that we need to develop self-awareness. And I spoke about that in past slides. So know what we think, we know our biases, know us, so that we can get to know other cultures. Demonstrating knowledge and understanding of patients' cultures. And it's okay to say that I've never taken care of a Muslim patient or a transgender patient. It's okay to say that. It's not okay to not want to take care of them because of that. And then understanding a patient's culture is learning about it. So if you don't know about it, learn about it. Third is accepting and respecting cultural differences. We have to accept, we have to respect. We don't assume anything. So not assuming that healthcare providers' beliefs and values are the same as the client's. So we don't assume that just because I'm Hispanic and the next person is Hispanic, we're going to be the exact same. Resisting judgmental attitudes such as different is not good. Being open and comfortable with cultural encounters. This is a huge one, especially because in a healthcare setting, we're not going to see, we're not going to be aware of different cultural encounters until we actually encounter them, which can make it a little difficult, but it's still important to either learn about that culture you're encountering, ask questions, be respectful, and then accepting the responsibility for one's own cultural competency. So that's the same. It's if I'm not aware of a certain culture, ethnicity, or something, I'm gonna find a way to look it up, ask the patient themselves what their preferences are. If they're not able to answer, ask family members if they're present. So continue education, continue educating yourself to create a culture of cultural competence. So some factors that affect culturally diverse interactions. So if I'm a nurse and I have my own culture, my own history, my own ethnicity, my, whatever it is that that group that I believe I belong into, and I'm taking care of a patient with a completely different set of cultural values about health, and how does that affect that interaction between the two of us? Well, it is affected by the cultural background of each participant, especially if it's completely different than the other. Expectation and beliefs of each person about healthcare. So we might just have different expectations about what is going on. Cultural context of the encounter. So just knowing how I feel about certain things, let's say birth control, it might not be the exact same as the person I'm taking care of. There's a degree of agreement between the sets of beliefs and values of the two persons. Hopefully at one point, it's not a strained and not a strained interaction between the patient and yourself, or I guess in this example it would be myself, just because the patient is has a different cultural value about health. So it shouldn't cause a strain, and as a nurse, we should be able to kind of work with what we got and kind of put our own beliefs and stuff aside so we can provide appropriate care. So how do we do cultural assessments, or how do we figure out what our patients need based on their cultural needs? So we ask, we assess, what are your beliefs? What are your values, traditions, and practices of culture? Set some definitions for health-related needs of the individuals, the families, or the communities. Culturally based belief systems of etiology of illness and disease, those related to health and healing. And then attitudes towards seeking help from healthcare providers. So think about the first bullet is beliefs, values, and traditions and practices of a culture. So we know some cultures believe in healers and non-Western medicine traditions, like using salves from plants, or making teas from certain plants and things like that. And let's see, bullet point 2, culturally defined health-related needs of the individuals, families, and communities. So it's knowing what to expect from these different cultures and investigating what they want. So it's as simple as asking, is there any cultural considerations regarding your health that I need to be aware of? Most patients are great at answering those questions. What are their beliefs about the cause of diseases? So think about in Asian cultures where they have like the yin and the yang, and sometimes they believe they're sick because there's an imbalance in that, and knowing those things will help us pinpoint and assist these patients and start with their healing process. A big one is attitudes towards seeking help from healthcare providers. That's the last bullet, and that is, we know certain cultures do not like to seek traditional Western medicine help. They might, excuse me, they might seek help from healers, or I like to call them, in Spanish, they're called curanderos, or herbologists, and even like alternative medicine things. But they refuse to go to the hospital, primary care provider, things like that. They refuse to take certain medications. It's those barriers that we need to assess and figure out how to work with the patient to make sure it is in their best interest. Well, it looks like we're done. So if you have any questions, write them down now, and then we'll definitely discuss this in our lecture. See you all on Tuesday.